Okay, so it's a small review about the iron deficiency anemia and megaloblastic anemia. So first we'll talk about the iron deficiency and anemia and the main important factors related to this. First we'll talk about the hemoglobin at birth. It is 20 gram per deciliter and 10 gram per deciliter at the age of 3 months, and in male it is 14, as we all know, and in female it is 12 gram per deciliter. Serum iron level is 50 to 150 milligram per deciliter. This is important, and the transport iron contains 3 milligram of iron. So one more thing is important over here, it's pulse Persian strain, which is used for the investigation, and investigation of choice will check the hemoglobin level, plus we will check some other levels. For example, TIBC, that is total iron binding capacity, will increase, red cell protoporphyrin will increase, serum iron will decrease, serum ferritin will decrease, and HbA will decrease eventually. And we'll talk about the serum ferritin level. It is 15 to 400 microgram per liter, and in iron deficiency it will be less than 12 microgram per liter. And we'll talk about the treatment. It is 200 milligram ferrous sulfate can be given 3 times a day, and 100 milligram iron injection can be given, that is the dextran, and 125 milligram in 100 ml we can add in the normal saline. This is sodium ferric gluconate, and we can also add in iron sucrose in 100 ml normal saline, and the doses will be like 100 mg. That can be given IV route. Then come to the megaloblastic anemia. It can be due to vitamin B12 deficiency and folate deficiency. In this we'll check on the MCV levels. If it is more than 110 femtoliter, then it is related to vitamin B12 and folate deficiency. And if MCV level is 100 to 110, between 100 and 110 femtoliter, it is related to alcohol, liver disease, hypothyroidism, hemolysis, pregnancy. The serum level of vitamin B12 is 200 to 600 picogram per milliliter. It is normal level. If it is less than 200 nanogram, then it is anemic. And the vitamin B12, like the daily intake should be 1 microgram per day, and the body storage is 5 mg, and the daily folate intake is 100 microgram per day. The serum level folate is 5 to 20 nanogram per ml. If it is less than 4 nanogram, it can be anemic. The investigation of what we will see over here, we will find out the hypersegmental neutrophil, more than 5 lobes are present, increase in ESR, and Schilling test. In Schilling test we will give some doses, and later on we'll see the excretion through the urine. And then management can be given as like hydroxycobalamin 1000 microgram twice weekly. We can give folic acid 5 milligram once a week, and 350 milligram daily in pregnancy we should give. It is a question of PSM. It is a repeated question. In methotrexate therapy, to overcome the metabolic block, folinic acid 15 mg daily is used orally. As IM or IV, we can use 3 milligram per ml. Autonomic peripheral neuropathy, oral methylcobalamin can be used. The doses will be like 1500 microgram per oral for 7 days.